ladies, I'd like to discuss something with you. A lot of the times your physicians, your regular primary care doctors may not know about this particular topic, but in actuality, if you have had a child or planning to have a child, these are considerations that you might want to think about. Very often, there's a condition called estrogen dominance. And for those women who are estrogen dominant, sometimes that increases a risk factor for things like postpartum depression or postpartum psychosis. And many times women really cannot connect the dots between their particular chemistry, or if they're estrogen dominant, and how they are feeling. Now, many women go through postpartum depression. It's something that happens, I can't say naturally, but it does occur. Some of it is severe, some of it is really very, very lightweight, and they may not notice. And it depends on what all is going on with you in your life at the time. And all of those factors that are imposed upon you can certainly affect your mood and demeanor. At the lowest level of that, postpartum depression is caused by elevations of copper. When that happens, your brain is actually being influenced by the high amount of copper that's there. And since it has a electrical conduction connected to it, that means it makes short-circuiting a little bit of a problem. So you can overthink, underthink, misdirect. Whatever happens in there is not the end result of what was intended. Now, the very worst case of this in terms of what copper can do to a brain really has to do with postpartum psychosis. That's when copper levels are so high and so extreme until short-circuiting is exactly what's going up there, and it just kind of comes down to physics, really. So your brain, being an electrical conduction unit that it is, simply cannot function the way it's supposed to, and everything, every thought, every process can be misdirected, to be quite frank with you. So these things can be helped, though. There's a way to control that. There's many ways to fix that particular problem so that your overall processing of information is really the way that you want it to be. So if that is the case, if you've had those kind of experiences, or you know someone who has, there is help that can come to you. But you would have to get your chemistry checked in order to find out what really your biochemistry is about and what could be done about it. Anything that you can put in balance works much better than not being in balance. And here we believe really in biochemical individuality, but unless you check, you're not going to know.